Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors, by the doctors, where we are here on a mission to help doctors to guide them for their career growth, and we do that by interviewing experienced medical professionals every week, Wednesdays and Sundays. And today we have Dr. Rajyalakshmi with us. She has been with us before as well, discussing about the scope and opportunities about her lifestyle as a neurosurgeon, and she's again here to discuss about fellowships in neurosurgery. What are the kind of fellowships if somebody wants to pursue, and what is she doing right now? Welcome, Dr. Rajyalakshmi, on the platform. It's really nice to have you here again.
Hi, hello Arish.
Yes. So if you can, give us a brief for our new viewers, how has your journey been till now?
It took almost around 12 to 13 years to become an completed neurosurgeon. And again, now I started up my fellowship in neuroendoscopy. So it has become like one more year getting added upon. So we started from your MBBS, and after that, we are going to crack up an entrance exam for taking up an MS. Of course, there are a direct MCH recruitment seats. A few of the countable number of seats are there after MBBS also. So I took up an MS, and then followed by again I had written examination. Again I cracked the entrance, and I got my MCH neurosurgery. And I had been into practice after finishing my MCH. And meanwhile, I also started attempting my fellowship entrance examinations. So then I cracked my neuroendoscopy fellowship in Jabalpur now.
Correct. Glad to know.
Yeah.
And
So that's how
yes. And actually, congratulations that you're starting with your fellowship again, and going through the journey of studies. I believe we as doctors are always ambitious to study again and again. I see that always. So now, when you mention about fellowships, what are the kinds of fellowships that are there, and which do you think is should be that should be pursued?
See, what we are speaking about fellowship in neurosurgery is completing your MCH or DNB neurosurgery.
Definitely.
So either it is 6 years or your 3 years courses. After completing this, we are dealing with the fellowships. See, actually, many of the neurosurgical residents does not know or does not bother about the subspecialties or subspecialties in super specialty, we can say. So neurosurgery is considered as a super specialty, and again now it is subspecialty in super specialty. That is super selective particular things we are going on. So now we are going to focus on selective diseases, and that includes your fellowships. So we have almost 10 fellowships, but the main problem is like people doesn't have time. After they pass out, they are in a hurry, or they are much interested into starting up their practice and start minting their money or their career. So very few people are like oriented for their fellowship. So in India, if you are considering, we have almost 10 fellowships, which I am going to sum you up. So the first one starts with the fellowship in Neuro-Oncology. So that is, this fellowship is going to deal specially with your brain tumors alone. So they are going to give you an high-end training with the fluorescence-based and also high-end techniques of dissection of the brain tumors. So this fellowship in Neuro-Oncology is available only in Tata, and they have only 1 or 2 seats in a year, and they have only 1 entrance exam in a year. So there is no other seats available anywhere in India. Only Tata Memorial Bombay have this fellowship in neuro-oncology. So the second thing comes is fellowship in neuroendoscopy. Here we are not dealing with a specific disease of the brain. So we are dealing with an instrument that is an endoscope. So like how the other endoscopes are, it is also an endoscope. But we get to do only with an endoscope all access to the surface of the brain and also all disease of the brain. So that's how these people are going to get trained. So there is again only 3 seats of neuroendoscopy available. And in all over India, only in Jabalpur, Netaji Subhash Chandra Bose Medical College is providing this neuroendoscopy fellowship. They usually provide this fellowship twice in a year. They conduct an exam, and we have to clear the theory and practicals and an interview, and then they will select us. So we have twice in a year. And then we have fellowship in cerebrovascular surgery. Here, cerebrovascular means it is open. In neuro surgery, we have two vascular accesses. One is endovascular, that is without any using the knife. Just by using a needle and a catheter, we can actually access. That is endovascular. Second is cerebrovascular. That is, we use the knife, we do a craniotomy, and then use the things for surgical management of vascular lesions. So, a experienced neurosurgeon is the person who can deal the best with your vascular disorders. Okay, so fellowship in cerebrovascular surgery is dealing best only with open vascular surgeries. And this is available both in AIMS and also Sri Chitra. Chitra Trivandrum and also AIMS Delhi. Sri Chitra has only once in a year exam, and that way provide only 1 or 2 seats. And AIMS have when 6 monthly once exam, that is biannually, twice in a year exam, and that also again have only 1 or 2 seats. Both these entrance exams are highly competitive, highly influential. So we have to crack our theory again, practicals, and also interview. Then we have something called fellowship in endovascular intervention. So this is where the actual clue comes here. That is, this fellowship in endovascular intervention is open to all the DM neuro radio candidates, DM neuro candidates, radiology candidates. Everybody are open to have an access here. Okay. So everybody are going to compete for this exam. So that is when the competition is actually picking up more in fellowship in endovascular. And endovascular intervention per se is provided by National Board of Entrance Examination, NB, NAT Board Fellowship Entrance Test. And for neurosurgeons and also for neurologists, we also have 2 dedicated teams like Society of Intervention Neurovascular Surgeries, Society of Neurovascular Intervention, SINB in India, where we have to register in their websites and get their approvals done. Then followed by a recommendation letter and followed by clearance, we can get that. Okay. And usually this course is for 2 years. That is also one of the reasons that many neurologists and neurosurgeon doesn't prefer to take this branch because it is 2 years duration. Okay. So this is what about endovascular. Coming to fellowship in skull base. Skull base, again, there are seats in both AIMS Delhi and also Sri Chitra. So skull base is going to deal with the skull base tumors. Again, it is the same, competition high, and there is only 1 seat. Both in AIMS also, Sri Chitra also, there is only one seat each. And the examinations are as normal like this, like as we discussed previously. Yes. Then we have fellowship in spinal surgery. This spinal surgery fellowship has the 2 open categories in India. One is CMC Fellow. CMC Fellow provides in fellowship in spinal surgery. They deal basically with the complex spine surgeries, not with the simple spine surgeries, what they are trained with. And second is with NAT board fellowship entrance. But again, the problem comes with competition. That is, orthopedics people also are eligible to write for spinal fellowships. So when come to spinal surgery, even AIMS provides the spinal surgery. NAT board, AIMS, and CMC value provides it. So when orthopedics people also compete, the competition is going to be high, and there is every chance that only one candidate will go into it. Okay. Then comes your fellowship in epilepsy surgery or functional neurosurgery. Both are actually combined. Here, what they do is most of the time it is an implant like DBS for Parkinson's disease. So these people are getting actively trained in it and also in performing epilepsy surgery. And we have only 1 seat in India, and this seat is provided from AIMS. And this is under Dr. Sarath Chandra sir. He's the director of Center of Excellence in Epilepsy. And only AIMS provides only 1 seat in fellowship in functional neurosurgery. That along with it is combined with epilepsy also. Okay. So again, the same thing. It is conducted twice in a year, and the competition is going to be huge. So 1 seat, and the competitors, even though if it is 5 or 6 or 10, it doesn't matter. If we are standing in the second position, we lost it. We have to be in the 1st position, both in interview also, theory also, practicals also, to crack in that. Definitely. And the last one is fellowship in pediatric neurosurgery. So these people are getting dedicated training only in pediatric problems, like in hydrocephalus, like in craniofacial malformations, and many other only dedicated pediatric things. But many people doesn't show interest in this pediatric part, and seats are getting vacant in AIMS. Probably the reason behind is pediatric neurosurgery per se is actually containing only the smaller part of population of India. Neurosurgery per se includes only small amount of disease population. So pediatric neurosurgery again per se it includes only very small subset. So probably that should have been one reason that why seats get vacant here. But say pediatric neurosurgery is also a very good branch to specialize in it. And many female and male neurosurgeons have actually did it and started practicing also.
Acha. Okay.
So this is what about the 10 sub specialties of fellowships available after neurosurgery.
Neurosurgery. So, glad to know about each one of it in detail. Just wanted to ask one more thing on this. You, after MCH, are pursuing fellowship, right? What is the need of, why did you feel the need of doing that? What, why are you doing it now?
Yeah, I'll answer this question from my heart, okay?
Yes.
So, see, I am into this practice from past 1 year. The area where I'm practicing have around 45 to 50 neurosurgeons crux, in which there is a population of around 35 lakhs. What happens? Everybody else practices general neurosurgery. I am also practicing general neurosurgery. Over a period of time, I started getting fatigued that there's nothing like great things what I am doing, or there's nothing like finest things what I am doing. So I need to get a opportunity to in such a way that I am looking only at the precious things, like only dedicated part is dealt by me with a high success rate. So that is when this super specialty followed by a fellowship concept came. And if I need to dictate myself as separate and stand alone in all the field of neurosurgeons, then I should have my own independent skill and also a own fellowship. That is when I can stand alone. And the third thing is, after a period of 10 years, there is a rapid ratio of increase in super specialty seats. So the number of outcoming people of super specialty and the pass outs are also more. So once the pass outs are more, the competition is going to get diluted a lot. So after a period of 10 years, if I want to stand in the commercial market area, if we want to speak in literal terms, so I need to stand on a dedicated area. Then only I can stand. It is not about the practice of general neurosurgery, which includes in spine, cranium, or some part of brain tumors. It's not like that. We are going to be highly specific, highly disease specific, and we are going to produce the best results. That gives actually more satisfaction than doing the general neurosurgery part.
Okay. Good. I believe you are, you are right on that, because it's very much important to find your specific niche and to build that X factor for yourself in your practice.
Exactly.
So now you have already mentioned the different kinds of, especially the Indian institutes that are giving these kinds of the fellowships. If somebody wants to pursue internationally, what are the good institute to go for, and what are the places that you suggest to do?
Yeah, see, as per the two main countries, like in USA and UK, in US, for you to get into a fellowship, you have to clear your USMLE and you should have your USMLE score. Only then you will get an observership or your fellowship opportunity. Similarly, in your UK, you should have been registered as a GMC practitioner with a GMC registration, or you should have your FRCS or your PLAB clearance. Then they would think of placing you in observership or fellowship. While in other countries like in South Korea or in North Korea or in Germany or in Japan, we just need to take their mails and also send our CV and also a recommendation letters to them with some known persons of our professors. And they usually respond to us. They give a fellowship for an observership opportunity for a period of 1 year, out of which some are actually sponsored too. Japan actually provides a huge number of opportunities for Indian neurosurgeons, and some of them are sponsored. That is, they provide accommodation, they provide a basic pay for your food and your basic work and all. So for 1 year, they'll provide us. But the problem with even Australia does that. Australia, Germany, Korea, Korean countries, and also Japan. All these have opportunities. But there is a small problem. That is, as an outsiders of their own country, they don't usually give hands-on experience a lot. They might give some, but they will not be giving a hands-on experience a lot. So, but in Indian countries, it is not like that. Indian countries, we have a huge hands-on experience.
Correct.
Yeah.
Correct. Okay. So, glad to know about all of this. But what are the, major institutes that you will like to suggest internationally, that if somebody wants to go for, which are the best ones?
Major institutes internationally.
Yes, yes, yes.
See, you're going to apply on an individual basis to individual person. So if it is going to be in Japan, we're going to apply to Professor Yoko Kato, and
Okay.
she's going to be the renowned vascular neurosurgeon there. And
Okay.
under her guidance, many students, both internationally and nationally, are getting trained. So for them, in USA, if it is concerned, you can apply. You can apply for this Barrow Neurological Societies.
Mm-hmm.
So they usually take it for observership. And also to Dr. Lalingam Shekhar sir, he is also an Indian come US citizen. So you can also apply for him for his observership opportunity. So we
Okay.
actually provided these sort of opportunities for us.
Okay.
See, actually speaking, it is difficult to crack in fellowship exam in India, and it is quite easy to
To do it
get entry
international.
into foreign countries. Even though it is observership, in India, foreign degree actually matters, at least for the patient point of view. But when a sound knowledge person thinks over it, they actually think of patient prognosis and the surgical result.
Yes,
But
yes,
it is very difficult to crack in Indian scenario fellowship when compared to a foreign entry.
yes, yes, yes. I,
Because
I
you
com-
can compare, right? One fellowship seat is equal to, and the competition is almost like 10 times more than that. And you have to crack rank one and be in the rank one for both theory, practical, and interview. And you should be able to convince every person who is sitting in the interview that you are the right candidate. And that always may not be possible.
yes, yes, correctly. It is very difficult.
Yeah.
It's very difficult to be the only one person. Correctly said.
Right.
Actually, the idea of asking me for international thing is, there are many people who are interested to move abroad. So that is the reason I was asking you in detail.
Yeah, but the problem is after finishing their neurosurgery, if they want to go abroad and still practice neurosurgery, then comes your difficulty. So usually in a complicated branch like surgical branches and especially neurosurgery and all, so they usually take consultants only after they take them as a consultant only after 7 years. So
Okay.
in UK and US and all, they have to complete their 7 years of their neurosurgical residency again there, and then they'll be considered as a consultant there. So they're not directly considered as the consultants after completing their degrees from India because that is not completely
Mhm.
recognized there.
Yes, 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 yes.
Only exception is in UAE country, like in Saudi Arabia and Dubai. These
Mm-hmm.
countries actually favored of Indian doctors, but
Mm-hmm.
there is an advantage to have an FRCS or an MRCS degree added to the branches.
Mm-hmm.
So having an additional MRCS and FRCS will get in will fetch you a lot of good income and also a lot of good reputation and easy entry to your UAE countries like in Saudi and also the other things.
Yes, yes, yes. Correct,
Yeah.
correct. So now, after doing all of the fellowships, whether India or international, what are the kind of opportunities a person can get?
Yeah, see, opportunity is one thing. As per the Indian neurosurgery is concerned, we are actually self-creating the opportunities. So
Mm-hmm.
we don't have an open access after finishing the fellowship that we are considering as a cerebrovascular surgeon, or we are considering as an only endoscopic neurosurgeon. I'm going to do only endoscopies. No, it is not going to happen.
Definitely.
So we are going to do all the cases. Along with we are going to do your endoscopy. We are going to do all along with we are going to touch your cerebrovascular. But the only advantage of having fellowship is you are very specific in that particular disease.
Mm-hmm.
So when compared to the others, you are very specific and your success rate for the patient is going to be very high, unlike others. This is two things. And second, many of the corporates or many of the government does not have a special recognition for fellowship or neither going to give a special cadre.
Yes.
So we are going to slowly build up our practice. On addition of it, we are going to have this fellowship, which is going to give us a better versions. And there are few fellowship like in pediatric neurosurgery and like in fellowship in neuroendoscopy. These two are two fellowships where we can actually independently stand. So this does not need always a great team effort. Of course, as a neurosurgery itself, we need a team effort of orthopedician and also neurologist and then trauma emergency handling team. But as per fellowship in endoscopy and pediatric is concerned, we don't need such amount of great team effort. But in functional and also cerebrovascular And in endovascular, we always need dedicated team effort, completely dedicated team effort, and without which we will not be able to successfully create a good percentage of successful outcomes in patients.
Okay.
Ultimately, what actually matters in deciding what fellowship you want is where you're going to settle in and how you want to settle up, and are you planning to settle only in a combined setup. So there is no point of taking endovascular and functional when you are not planning in a combined setup, because see, the DSA suite of neurointervention itself costs in somewhere in crores. And unless and until I do somewhere around 5 cases to 10 cases of intervention per month, it is no benefit of investing that amount. So 5 to 10 cases to get independently is simply not possible. So we have to get a reference from every neurologist and neurosurgeon that we are doing these intervention cases. So it's combinedly a team effort that everybody has to refer us these particular specific cases, then they'll be able to do. That's what. So that is the main disadvantage of fellowships also here. Like people consider that these fellows are doing only this subspecialty. No, they do general, along with they do highly specific
tasks as well.
fellowship. Yeah.
Correct. Glad to know about all of this, and I'm sure that you are absolutely right. That adds to your confidence as well as increases your success rate with that thing.
Yeah, exactly.
So now we have multiple questions for you. Actually, we had a question from a yesterday video. Dr. Abhishek asked us, please, what is the saturation in cities like Indore and Jaipur for a neurosurgeon?
What is the saturation like, right?
Yes, saturation, yes.
See, not only Indore or Jaipur, almost all cities are saturated well. The main problem is like experienced neurosurgeons who had been present from a long time. So they had captured a very good fame, and also they had developed a ground-based network for themselves.
Yes.
For an upcomer to again build up under them is simply not going to be possible. So almost all cities are actually highly saturated. So now the grade 2 cities are actually the best option for neurosurgeons. So that is why we find out many neurosurgeons are actually moving out from grade 1 to grade 2. And as per the income is also concerned, grade 2 are actually giving up more income when compared to grade 1, because grade 1 cities usually people work under corporate setup. Corporate doctors will be like a slaves almost. I mean, variation might decision or opinion might vary, but still what they get is from the hospital. The corporate dictates the pay, right?
Yes.
So, but in the grade 2 cities, it is not like that. The universities themselves dictate the pay. So if they want to do a lots of cases, they will do it up. If they don't want to do a lots of cases in that month, they'll relax. It depends upon them.
Yes.
So it depends upon their ability to build up their income and everything. So in grade 2, actually, they're meeting up lot, and setting up an independent specialty or independent hospital establishment is also more in grade 2. And he rightly asked that saturation is pretty high in all metropolitan cities and also in Indore and Jaipur also. Yes, they do get an opportunities. It is not like vacancies are not there. Vacancies always will be there. When one person or a neurosurgeon moves out, other neurosurgeon will enter into it. But it is always like in fixed pay negotiation.
Okay.
So there is a rigid pay scale from the corporate setup, and in that rigid pay scale only they are going to enter it up.
Okay. And what is when you mentioned that people in in the metros as well and people in the tier 1 tier 2 towns are earning more comparatively, what is the pay scale? If you can just mention for a fresh pass out neurosurgeon, what is the pay scale?
See, in grade 1 cities and all, fresh pass out will be offered around 2.5 to 3.5. Okay. So this is the minimal thing what they'll get offered. Something like in a periphery, if we come grade 2 and all, if you are still going in corporate in grade 2, they can offer from again 3.5 to 4.5.
Okay.
So wherever they go, 5 is the maximum limit that they are offering for a fresh part. 5 is actually more, but it is the highest what I had seen that they're offering for a fresh candidate. For an experienced candidate, it always varies. For an experienced candidate who is well established in vascular or in other things, the pay can range from 8 to 10.
Okay.
And it is not exaggerating. and it's in lakhs only.
Yes, yes, yes.
Yeah. So they can be from 8 to 10 in experienced candidates. But there are in metropolitan cities. I don't want to take an example of the city name, but there are also areas where neurosurgeons are actually struggling to live. They're getting a pay of only 75 to 90,000 or only 1 lakh. That is because of super saturation of these neurosurgeons. Not only neurosurgeon for that matter, super specialties are actually getting super saturated in that particular city or area. So the pay scale is so low. So the most important is we should not go in the blind belief that hospitals are going to open up their doors and are welcoming us. Nothing is going to happen like that. So we are again going to start our opportunity search, again going to start our career search, and then decide which city is suitable for our growth. That is very important. So whenever we are selecting a city, we should select an area where temporarily we might get a lot of income, but it doesn't matter in long term. So after a period of 1 to 2 years, if we are getting only 2.53, we will get fatigued, despite doing the despite amount of lots of hard work. So you should develop a city. You should get into a city which has a growth potential. So see the city which has growth potential. See the number of practicing neurosurgeons. So the density of the population and nearest hospital availability, nearest emergency care services, the availability of referrals. How does the practice go on? So this all has to be checked before we are starting up a career in neurosurgery, as per the freshers are concerned. So this is how we actually think about it.
Correct. This is very important. And anything else that you want to add to setting up the practice? Because you have, how did you choose the city? You know, because I know you are traveling. You work at
Yeah.
places. So
See,
how?
the thing is, no, it's always a team effort. Whenever we are choosing up a city, we know that we are going to either. I had chosen a city where I'm the only neurosurgery practitioner.
Okay.
So every referral will go via me or will stop at me. Unless and until I reject a case, it will not go beyond me. So the main thing here is I have to attract the patients and know everybody that neurosurgeon is here for their availability. This is how they should come to know. Second, neurosurgery is not like a simple clinic establishment. So we can't establish a small clinic and start sitting. It was in an olden sector where they used to do that. So, but now it is simply impossible. So neurosurgery, the core neurosurgical branches is always with emergencies. Like in brain trauma or head injuries or with spinal trauma, it's always in emergencies. So you should have an emergency setup there, which is 24 into 7 available. And polytrauma patients is a common one they are going to start up with a setup. So polytrauma invariably will have abdominal injuries or orthopedic injuries. So you're going to have a team tie up with an intensive care specialist, a general surgeon, an orthopedician, and also a duty emergency officers. So that's how your team runs. So once this team runs, any patient who is coming up with a polytrauma can be having a combined admission and everybody can look at a patient. So that will actually give more amount of peace to you. If you are sole practitioner and taking up all the burden to you, after a period of 3 to 6 months duration, you will really feel fatigued or vexed up with the service what you're providing.
Yes.
But if you have planned and if you are doing it in a planned event, like divide it and plan it and do, then you will move only with your duties on. So that will give you more amount of peace, satisfaction, and a complete cure for the treatment.
Correct. Hey, actually, this is all of this is really nice to know, because this is very important for a fresh graduate to understand.
Exactly.
Yes. So now let's end this on a high note. You know, any motivational words from your end that actually keeps you motivated always?
Yeah, education will never end, but we should know when to stop also. And we should never always take up an opportunity whenever it comes to us. We should never lose up an opportunity when we already have it. So after 10 years, what could be your potential of growth? That is what you're going to imagine, and then you're going to study further. So after 10 years, how you want to settle up is what is more important than the only present situation. So persistent hard work with determination and your willpower will always give success. If not now, either it can be later. It will always give you success.
Correct.
That's all.
And I'm sure that is the reason that you also, pursued your fellowship and decided to go for it, because you are also viewing yourself 10 years down the line, and so, wished to do that. And that's
Yeah.
actually really true. That's the way to view your career growth. And correctly said that you also need to understand when to stop with your studies and with your education pattern. Obviously, studying goes always with medicine, it's never going to stop. But yes, coming to the real life and the practicing life is also very, very important.
Exactly.
Thank you so much, Dr. Rajyalakshmi, for all this insightful discussion. It's always so nice to have you here and to get into a discussion with you. It's always so insightful, and with to know lots of things about the subject. Thank you so much again. I'm sure all of the viewers are must be really happy with the insights that you have just discussed with us. Do share it with your friends and colleagues. Anybody who is looking to pursue neurosurgery, this will be something that will be helpful for them. Do share it with them. Also, if you have a mentor in your life, or you are a mentor to many of your students, do connect with us. We will love to cover you, because we want more and more mentors to connect with us, to spread their knowledge with the upcoming medical students, so that they can get the knowledge that you have, and that may help them with their career growth. Thank you so much, Dr. Rajyalakshmi. Thank you so much, everyone, for joining us at this time. Do follow us on our Instagram and YouTube page as well. You will find all our old videos there, as well as there is one of an old video from Dr. Rajyalakshmi itself about neurosurgery, why the lifestyle in it, and everything about the basic neurosurgery. Somebody after MBBS wants to pursue that's another very insightful discussion that will help you to understand about neurosurgery in depth. Do watch that interview as well. That's another very insightful discussion with Dr. Rajyalakshmi. Thank you so much, everyone. Thank you, Dr. Rajyalakshmi, again. Yes.
Bye.
See you again, everybody, again on Sunday at 11 a.m. with another insightful discussion. Thank you, everyone. Bye-bye. Bye-bye, doctor. Good night.
Bye. Good night.